Hello, welcome all. Our today's topic is Odontogenic Keratocyst. It is a non-inflammatory odontogenic cyst. Pinberg and Hansen in 1963 first described OKC. Why does OKC name OKC? Okay, so Odontogenic Keratocyst. Odontogenic means, as we all familiar with this name, odontogenic means tooth forming, and keratocyst means the lining epithelium which produces so much keratin that almost fill the cystic lumen. That is why it's named keratocyst. OKC is quite a controversial topic between pathologists. This is because till 2005 its name is OKC, but in 2005 WHO came with new classification and named it KCOT. That means keratocystic odontogenic tumor. It is considered as tumor because of its increased recurrence rate. It's very aggressive in nature and the mutation of PAT gene. But in 2017, it is reclassified and named as OKC. Right? Okay, pathogenesis. It arises from dental lamina or its remnants. Or its remnants. Or it arises from basal cells from overlying mucosa. Or it can arise from enamel organ. By the degeneration of stellate reticulum. Okay, clinical features are second and third decade. Males are more affected than females, right? Second and third decade are more prone to OKC, right? Males are more affected than females, and site is mandible. Maxilla में भी होता है, but mandible is like more easier, right? Involvement of mandible, right? And maxilla. And mandible, 50% of these are involved from third molar ramus region, right? There is no clinical manifestation of keratocyst. Although about 50% of the patients are symptomatic before seeking any kind of treatment. So most common features are pain, soft tissue swelling, drainage, expansion of bone, various neurological manifestations such as paresthesia of lip and teeth. Okay, so radiographic features are it's unilocular, right? OKC demonstrate unilocular radiolucency. With smooth and distinct sclerotic margins, right? It can be multilocular also. Multilocular radiolucency is also seen, right? 23% of all OKCs to be multilocular, right? Multilocular variety is also misdiagnosed with ameloblastoma, right? Multilocular OKC may be present in nemoid basal cell carcinoma syndrome, also known as Golden Gall syndrome, right? Golden Gall syndrome. Okay, there are radiological variant of OKC. There are 4 radiological variant of OKC, right? Okay. First one is replacement type. First one is replacement type. It is found in place of normal tooth. In place of normal tooth, right? Example, primordial cyst. Like this, in place of normal tooth. ठीक है? Second one is envelopmental type. It encloses the impacted tooth. Encloses the impacted tooth, right? It mimics circumferential type of dentogenic cyst, can be differentiated on the basis of attachment of the cystic lining, right? डेंटोजेनिक सिस्ट की जो अटैचमेंट होती है वो हमेशा सी जैसे होती है, लेकिन ओकेसी में ऐसा कुछ नहीं है, ऐसी कोई अटैचमेंट आपको नहीं देखने को मिलेगी. थर्ड वन इज एक्सट्रेनियस टाइप. Extraneous type, right? It develops away from the tooth bearing area of the jaw. This one, यहाँ पे, ठीक है? Collateral type develops in between roots of the tooth. ये आप देख रहे हो कुछ इस तरह से डेवलप होगा. Okay, so now I'll talk about histopathological features of OKC. The first one is parakeratinized epithelium, right, which causes corrugation of surface corrugation, right? Second, the most important thing is 6 to 8 cells in thickness with basal layer of palissaded cells, or you can say nucleus. Okay, so there are a lot of possible reasons for recurrence, right? So occurrence of satellite cyst or daughter cyst, right, which is retained during enucleation process. Thin and fragile lining, which causes difficulty in nucleated completely, right? OKC mainly develops from the remnants of dental lamina.